we will start. So, okay, so your
Hello, I'm
station,
Dr. Maram.
your
What?
station is health anxiety disorder. Just give a chance for the candidates just to have a look at it in the
I
book.
thought you said 1, 2, 3 start. That's why.
No, I was going to start the recording. Just have a look at the station in order to understand what's going on and read it rapidly. It will help you to understand the scenario and to get accustomed with this type of stations. It is about this man who feels that he has a brain tumor, isn't it?
Mm-hmm.
Okay, so. Okay, doctor, don't forget one important thing. Whenever there is a station, please do not forget the risk assessment, even hypochondriasis. There can be some sort of financial risk. There can be some sort of self-remedy, which can be very hazardous. So don't miss this. Okay, we will start within a few seconds. Ready? 1, 2, 3, go.
Hello, Mr. Brown. I'm Dr. Maram Muhammad. I'm one of the psychiatrists in here. I've heard that you've been having a difficult time lately. Can we talk about that?
Hello, doctor. I don't want to be rude, but I didn't expect to talk to a psychiatrist. I was expecting a neurologist to help me with a particular investigation, which I want to do. And I'm not mad.
Yeah,
I wanted just to do a particular investigation.
I completely understand your confusion. Sometimes um, when we don't know the cause of a symptom in the body, we'll look for problems with the mind. And you know how the mind and the body are connected. So I'm here to help you out and support you. Is that okay?
Yeah, okay, no problem.
Okay. I know that you've been having headaches lately. Can you tell me how this started?
Well, it started 6 months ago. It is a typical type of headache which is associated with a brain tumor because I had an uncle which died about 9 months ago of brain tumor, and he was talking to me about this. He was experiencing the same thing which I am suffering from right now. And it seemed that it runs in the family, doctor. That's why I want to early detect it. And I feel that if you just allow me to do a PET scan, this will help me to know what's going on.
I can tell that you're very worried about this. When did this start, this headache?
Well, it started, as I said, 6 months ago.
Mm-hmm. Did anything happen before that?
As I told you, my uncle died 9 months ago before those, but
Yeah.
we know he had this brain cancer maybe for 1 year, and it started with him with the same type of headache which I'm suffering from right now.
I'm so sorry to hear about this. Yeah. Okay. Can you tell me how your headache has progressed through the past 6 months?
As what?
What have happened with the headache? Is it increasing or not?
Well, it is a type of dull aching headache, which, you cannot say exactly what's going on with him. It's not related to blood pressure. It's not related, to hunger or eating. It's just there. Sometimes it increases, sometimes it decreases. You cannot tell exactly in what part of the brain it is. It is typical of what my uncle was suffering from.
Mm-hmm. Okay. It seems like this is very stressful for you. And how sure are you that this is a brain tumor?
Well, I'm 100% sure because it is the typical headache of what my uncle was suffering from. And eventually he had a hard time because of the brain cancer. I don't want to go through this. They discovered it
Yeah.
very late after after it had spread all over his brain.
Yeah. I can tell this is difficult for you. So it seems like you've been having this headache and it's not really related to anything. It doesn't really
Yeah,
decrease or increase with something, and it's just continuously there.
yeah, very clear. Yeah.
Yeah. And there's no other symptoms with this. You feel anything else with it?
Like what?
Like maybe dizziness?
No, 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 no.
Okay, okay, that is good to know. I'm wondering if this has ever happened to you before.
No, this is the first time for me to have this type of headache.
This is the first time. Is there anything else that is worrying you other than this headache?
Well, I'm worried that I might suffer from brain cancer, doctor, because of it. Because I feel that I'm already having brain cancer, but in a very early stage that no one can detect. But I read that PET scan is able to detect it because it detects the abnormal metabolism and it is very sensitive to the tumors in the beginning. So I hope that you allow me to do this particular type of investigation.
So it seems like you've been asking for the investigation. I know they've done other investigations. When you do them, do you feel a little bit reassured or not?
What? What again?
I know that you've done investigations before.
Yes.
When you've done the investigations, how have you felt after?
Well, in the beginning, I felt that there's everything is okay, but the headache is still there. So it was a temporary reassurance, no more. And I felt that
Okay.
the doctors are not very sure whether there is something wrong or no. That's why I request more investigations to make sure that everything is okay.
Okay. Okay. What will happen if the doctor, refuses to do the PET scan? What will you do?
Well, definitely, I will seek to do it by another mean, but I don't have enough money to do this investigation. I spent a lot of money in doing brain scanning, and actually, I don't have enough money now for this type of scanning.
Okay, so it seems like this has affected your life quite drastically. Has it affected your relationships as well?
Well, I'm not able to go to my work because of this brain tumor. And my wife
Mm,
is not very happy because I'm always, worried about this and doing checking over the internet. And a lot of things are happening in my life because of this brain tumor. And definitely one of them is that my family life is not good.
Oh, I'm sorry to hear about this. With all of this going on, how has your mood been?
Well, I'm frustrated that the doctors are not able to know what's going on.
Yeah, I can understand that. How is that? Are you still interested to do the things that you used to
Yeah,
like?
definitely, but I'm not able because I have a medical problem. 1 minute remaining.
Okay. If you have any other physical health issues,
No, 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 no.
okay, that is good to know. I'm wondering during this difficult time, do you have any thoughts to harm yourself?
No, no, I don't have any of those. I want to save myself.
Okay, that is good to know. How are you coping with all of this?
Well, I don't know how to cope actually. I want to seek some sort of real support from anyone who understand my condition, but I cannot find anyone.
Yeah, I understand. Is this your first time going to a psychiatrist?
Yes,
Okay. Thank you so much for talking to me. It seems like you're suffering from something called health and anxiety disorder. This is something that we can deal with together and we can help support you with it. I would love to give you some pamphlets if that's okay.
very good, very good, very clever, very good. How do you feel about what you did?
um, I did well. I think I didn't have time to do the family history.
Well,
That's
it
what
was
I'm.
very good, by the way. The only thing which I hope that you would have covered, tell me more about your childhood, whether there is any past history of chronic illness in
Yeah,
the childhood.
exactly.
This
Yeah,
you could have put it in the family history or in the past history of the patient. Anyway, it
yeah.
was good. I hope that you can give the candidates can help us with the feedback. It's very supportive, very well done. Okay, so the only thing is that when you are you will always encounter this question: why am I talking to a psychiatrist? Please be ready with an answer because I felt that you're shocked in the beginning. So wow, you were not expecting this question, but expected
Mhm.
you might encounter this question a lot in the exam. For example, you can say that the mind and body is one unit, and many times the physical problems can have psychological reasons, particularly if all the investigations and the clinical assessment were within normal range. okay, or did not show any abnormality. So be ready with this type of justification to why I'm talking to a psychiatrist. Number two, please, doctor, pay attention to what I'm saying. I felt that you have your own questions, which you are going to say, ask whether I've said my, whatever I'm going to say. For example, I said it all started 6 months ago, and then you asked me again, when did it start? I told you, I volunteered and said that before that, my uncle died because of brain cancer, and then you asked me again, so what happened before the onset? So pay attention, or at least say, so I gathered that unfortunately, and when I said that my uncle died, you just say my condolences, must have been a difficult time. And you can say that I notice now that your uncle died before noticing this type of headache. Was there anything else? Okay, anything else other than the unfortunate death of your uncle and so on? But show that you are paying attention. Okay, you have a lot of fans here. They are all cheering for you. Okay, so let's see the yes. Let's see the so very good. You took the complaint in a very, very good way, by the way. So you asked about the onset, how did it progress, and how was everything before the onset, and you picked up that this man had his uncle passing away before the onset and very close to it. Okay, and it's very good that you did this because you will pick up all the tricks of the Royal College, which are mostly situated in the time before the onset, which unfortunately many of the candidates do not ask about. Nobody wakes in the morning, doctors with a psychiatric disorder. There must have been something before the onset. And then you ask about the symptoms of the syndrome at the time he is. Did you ask about the time he is consuming to the amount of his life spent in this because of this hypochondriasis? Did you ask how much
Not the
time?
amount of time.
No, ask him how much of time do you spend in checking? Do you feel that you're all the time thinking of this problem? So I did not feel that you did cover this. So you want to know, he is totally preoccupied by this problem, okay? You ask about the comorbidity, biopsychosocial. In this area, you could have asked about the past history regarding the childhood, the impact on coping and risk. You ask about them, and the past history and family history, you ask about them, and then you deliver the diagnosis. Very good. Now, this is the mark sheet. Let's see according to our mark sheet. Okay. You identify the issues and the priorities. Very good. You recognize the significant aspects of history. As you can see, there are many things in the history which you should cover. It's not only the symptomatology. Okay, you took the complaint, you took the comorbidity, the past history, family history. This is point number 2. Number 3. This might not be scored for you, Dr. Mram, because you did not show that you have established that this man is spending enough time of a big chunk of his life in searching for this type of tumor he's having, spending money to go to the doctors. He is now dropping his job, and everything in his life is circumscribed around this tumor. I did not feel it. So this point might or might not be scored for you. You asked him about the risk. As you can see, even in this type of station, you must also assess the risk. The patient health view, I think you asked me if there is any other explanation. The psychological and social information, you asked about them, the comorbidity and the impact on it. It was very organized, not formalic. Your attitude is, everything is in your communication is good. Well done, doctor. Very clever. Thank you so much.
Thank you. Thank you.
Okay, who would like to go next? I think we have a
Can I?
sequence out chat section. We don't want to be not heavy. So, Dr. Sami, you booked your turn before after her.
Yeah.
Okay. Muhammad Sami, yes. So what is your station, doctor?
Somatoform pain disorder.
Let me have a look at it because it is page 100, it is station number 117 in the get book.
Yeah.
Yeah, okay.
Yeah.
Okay, let's start. 1, 2, 3.
Hello, Mr. Easton. I'm Dr. Sami, one of psychiatrists working here. How are you today?
Well, I'm fine, doctor, but I don't want to be rude. I'm wondering why am I talking to a psychiatrist? I thought that I'm going to talk to a pain specialist because I have this chronic pain in my back.
Yeah, I understand your concern, Mr. Easton, but I want to tell you that there is some physical symptoms that may caused by psychological problems, especially when the blood test and imaging are within normal. Is it okay with you to discuss this?
Okay, no problem.
Thank you. I understand that you referred from your pain specialist.
Yeah.
Due to you have a chronic pain. So please, can you tell me more details about it?
Is this dull aching pain which is just always in my back, and it's agonizing me. I'm not comfortable because of it. You know, sometimes it goes, sometimes it comes, but all in all, it's disrupting all my life.
Oh, I'm sorry to hear that. It seems hard to you.
Yeah.
Can you tell me when it started?
Well, it started about 6 months ago.
Okay. And what things can increase it?
Well, I cannot tell you exactly. There is no particular thing, but you know, sometimes when I'm having a hard day at work, or sometimes when I quarrel with my wife, every time. I know that it is related to my life more than my effort. You know.
Okay. Did you notice anything that can decrease this pain?
Well, yeah, painkillers can decrease it temporarily, but not for a long time. And if I sleep,
Okay.
when I sleep and I wake up, this pain goes away.
Okay. There's sometimes the pain can contribute to stressors. So can I ask you, is there any major stressors in your life recently?
Well, I don't have any stress except that, I did, a final test for myself. It was very embarrassing that I'm not able to have babies. And this was about 9 months ago. It was a long course of investigations, and the last result was about 9 months ago that I am not able to have any babies. And my wife keeps asking me that we must have a baby. And as you can see, it's very difficult for me. It's nearly impossible.
Yeah. I see. It looks hard to you.
Yeah.
I'm sorry to hear that. Yeah. Okay. And I wonder, did you feel that you are tension most of the time? You are in the age, I mean.
Well, yeah, to some extent, I'm not able to tolerate the things which I used to tolerate. Yeah.
Oh, yeah, I see. Can I ask about your mood?
Well, it's not the best mood, but life goes on. You know, I'm not very happy, and at the same time, I can't say that I'm sad. I'm doing all what I can do to make life goes on.
Okay. Do you still enjoy things that you used to enjoy?
Yeah, doctor, I'm sure that well, must have things in my life to enjoy because I don't have the sort of family which everyone wish. So we have our own activities in order to make sure that life for us is also pleasurable like anyone else.
Yeah, I see. It seems hard to you. So, Mr. Houston, can you tell me how do you cope with all of this?
Well, like I said, that I'm able to cope. I'm just trying to live my life, but it's more and more difficult because my wife insists that we must have a child or adopt a child. It was not sorted out. We had two dogs. We have two dogs, but still, it's not enough.
Oh, so do you think that it may be a relation between this pain and this problem?
Well, I cannot sure, but I'm sure that there is back. I'm not faking stuff. There is a back
Uh,
pain and it's chronic, and sometimes I'm not able to work because of it. That's why I'm seeking support. I'm not faking this.
I'm so sorry. I'm not just listing this at all. I understand that you are really feel pain and you are not blamed for this. I understand this. So please don't feel offended. Just some routine questions. Is it okay?
Okay, no
Okay.
problem.
Okay. Some people under stress may feel an unusual feeling like hearing voices not around or
No,
seeing
no, no,
objects.
no, I'm not crazy.
Okay, great to know this. And I wonder if you
1 minute
have,
remaining, 1 minute.
okay, if you have any ideas of harming yourself,
No, no, no.
any ideas of harming others.
Harming my wife, you mean? No, no. Though she is making
Okay,
hard time for me, I don't want to harm.
okay, thank you. Great to know this. Just to recap, Mr. Houston, I understand that you have a pain, the aching pain, and I think it's a consequence with this problem with relationship with your partner, with your wife, and I think we will need another appointment to explain to you how we can manage this. It's a type of an anxiety disorder called somatoform pain disorder. Is it okay with you?
No, I don't understand. What do you mean?
It's a type of an anxiety disorder. It's a physical.
Time.
Sorry.
You should have prepared a simple explanation for the somatoform pain disorder. I didn't feel that you prepared an explanation because this is how you are going to deliver the diagnosis at the end of the station. It is your homework, doctor. This is your station which you have chosen, and so at the end of the station, you must deliver the diagnosis and have a simple explanation what is somatoform pain disorder. Okay, you can
Okay, so
simply
saying the diagnosis and
and
explain it,
simple
or
two words, and like simple somato. And we will see at the end of the station how now while we're discussing how to have a simple explanation about the somatoform pain disorder. So I hope that our candidates give us a feedback in the chat section and pay attention to their feedback, please.
okay.
Why didn't you ask me about what type of pain it is? Is it radiating to anywhere else? So I've expected just to ask me some, physical questions about the pain. Is it radiating to somewhere else? How do you describe this pain? Is it aching pain? stabbing pain. Very
You
important to
described
ask
it
these questions.
already, dull aching.
No, no, no. Dull aching is, this is what my words, but these are your questions. Okay. Number two. So if when you ask me about my mood and I give you a vague answer, so how would you rate your mood, making 1 the worst mood and 10 the best mood ever? Because I give you a very vague answer, so I expect you just make it clear for me. You asked me about the energy, you asked about the anhedonia, and I think you put. Now we will have a look at the slides. Okay, so here we start. How did it all start? What happened next? The progression, what is the explanation? How did it affect your life? What increased, what decreased, the type of pain? Is it radiating everything? This is called the course and duration, the onset. And how was everything before this? Were there any stressors? Okay, how was your life? I guess you asked about this. So you asked about how was everything before the onset, and you asked about the onset. The course and duration, you only missed the type of pain and the radiation and so on.
Yeah.
Now, symptoms of the syndrome, I think here it is simply a somatic pain. So you just try to establish that the link between this type of pain and the stressors. So what if he feels that this type of pain can be associated with any life stressors, and you want to establish the onset between it and the problem of not having a baby as a final issue in his life, because this was a final. It can be different scenarios. I know that in the book it is different, that he decided to postpone having children. Sometimes they say that he is having a final diagnosis of not having a pain, having children, and so on. You asked about the comorbidities, the depression, the social stressors, physical. Did you ask about any associated physical problems?
No, I missed this history, past and medical, and the family also.
No, just ask him if there is any other medical problems which you would like to discuss with me. The impact and coping and risk, how did it all affect his life? How he's coping with all this? Any thoughts of harming yourself? You covered this and so on. You did not ask him about did you ask about past history and family history?
No, I missed the history.
Doctor, there is a point in the aspects of history. When you miss the past history and family history, this is a very important aspect of the history. So this means that you're going to lose this in the mark sheet. Finally, there is the explanation, somatoform pain disorder, that you can see to him that the mind is passing through a tremendous stress, and this stress is converted into pain. And usually this pain comes in the back. It comes in many forms, but it is very common to be a pain in the back. Okay. Is this the most common type of somatoform pain? That's it. And I would like to have another appointment for you to see how we can help. That's it.
Okay.
Okay. Let's see a mark sheet. This is the mark sheet. Eventually, everything comes down to this mark sheet. Okay, this is our mark sheet. You identified the issues and priority. Unfortunately, aspects of history, some aspects were missing, so point 2 is going to be not scored for you. Does not elicit the predictor. You asked about this. You demonstrated adequate risk assessment. You paid sufficient attention to the patient physical and health. You identified enough psychological and social information. You were organized, except maybe at the end, your explanation of what is the somatoform pain disorder might make you lose 1 or 2 of these points, which is the language. Doctors, I know that this can be some sort of a bias, but however, this exam is an exam from the United Kingdom, and the mark sheet contains 2 points about the language. And this is a very big amount of scoring for the language. Can you? It is 17%. 17% of the scoring is related to the language. Can you imagine? And if you know that some candidates do not pass by half percent, they don't pass because they did not achieve half percent. So you can imagine the amount and the burden of these 2 points. Okay, so pay attention to your language. You must be prepared with suitable explanations whenever you are going to have history or taking station or having a management station. Okay, pay attention.
Okay.
Don't underestimate that. Okay, I lost the 2 points of language. No, this is too much. Too much, man. Other points, I think you've scored most of them, but unfortunately, the last 2 points because of your explanation, which was very could have been better.
Yeah, sure. Yeah.
Okay, so okay, so who would like to go next?
I will.
I can do
Okay,
it.
let us see the chat section. Okay, just have a minute. Usual, it is if it is GIT,
I
if it's skeletal muscle tissue.
think the next would be me, Prasanna.
Oh, okay, okay. Yeah, sorry. Yeah, right, usual. Yeah.
Actually, mine was the second station, Dr. Hussain.
Yeah, I don't know. Well, just wait, doctors. I think just to avoid this type of uncomfortable situation, that's why in the beginning I asked that everyone we can do a simple sequence or simple list of the doctors who want to do the stations. So we have Dr. Maram, then Dr. Muhammad Sami, and then we have Dr. Santosh. Dr. Santosh. According to this, maybe after Dr. Santosh, we will have Dr. Victoria. You are okay, doctor? Sorry, Dr. Victoria, no problem. Because in the chat section, I asked the candidates to have a list. So we have Dr. Santosh now. Okay, so
mine is station 15, panic disorder.
okay. Now we're going to start within a few seconds.
Yeah.
1, 2, 3, go.
Hello, Mr. Smith. I'm Dr. Kumar, one of the psychiatrists from mental health team. How are you doing today?
Well, I'm fine, but I don't know why I'm talking to psychiatrists. I want to see a cardiologist.
Yeah, I can understand your concerns, but since mind and body are one unit, and sometimes mental symptoms can reflect as bodily symptoms. And here we psychiatrists can provide some help and support, especially when the investigations are within normal limits, as it was in your case. So if you want, shall we go ahead for a small chat?
Yeah, no problem.
All right. So can you share your difficulties with me?
Well, I started doctor 6 months ago, and I started to have these times in which I feel that I'm about to die and I'm going to have a heart attack, and I always seek support from the medical emergency, but they do everything and everything is okay. With time, these attacks are increasing, but
Yeah, I can understand that it must have been difficult for you. So you said that it has been there for last 6 months, and
yeah.
how is it progressing since then?
Well, it's increasing, so it started maybe once every 2 weeks. Now I can have these attacks maybe 3 or 4 times a week.
Right. And how long these episodes last for usually?
Well, it lasts between 10 or 30 minutes maximum.
Right. Okay. So can you please tell me what happens during these episodes to your body?
Well, I feel trembling, doctor. I feel sweating. I feel horrible, doctor.
Mm-hmm. Do you feel your heart to be pounding very fast?
Yes, yes, yes.
Okay. And do you feel choking sensation in your throat
Yes,
during those
exactly,
episodes?
exactly.
Okay. What runs down to your mind during the periods? Do you feel as if you will not live anymore?
Yeah, I feel that I'm about to die, and I don't know what to do, and I'm trying. I try to seek help, and the only help which I think of is the medical emergency.
No, it must have been difficult actually. So, what happens in between the episodes?
Well, now, doctor, I'm very worried that I might get these attacks, so I'm staying at home most of the time. That whenever
Okay.
I'm having, I feel that I'm about to have these attacks, I seek help.
Do
I'm very worried
do
that now I'm always worried that I might get these attacks.
right. And do these episodes occur in any particular situation
No, no, there is no particular situation.
or any particular timing?
No, no,
Okay, that's good to know. And are there any situations in which you feel very anxious, and if you feel that escaping or leaving that situation is very difficult, do you feel anxious then?
no, no, no.
Okay, okay, fine. And are you worried about everyday small things?
Well, I'm a type of person who just tries to make everything around him okay. So yeah, maybe you can say that they always make me that say that I'm meticulous. I'm worried. Yeah,
Okay. And do you feel edgy, always on edge?
yeah, yeah, exactly.
Okay, fine. And do you do things repeatedly, like checking or washing things again and again?
No, no, no,
All right. And do you have any flashbacks or nightmares about any very difficult situation that you faced in your past life ever?
no, no, no,
All right. And do you find it difficult to face means or present yourself in a large group?
no, no, no.
Are you okay? Are you worried about any specific situation? I would say,
Like what?
like crowd or going to marketplaces.
No, no.
Okay. With all this going on, how is your mood?
Well, I'm so frustrated, doctor, because this problem now is totally devastating my life. I don't know what to do.
Yeah, I can understand. And are you able to enjoy things which you used to enjoy earlier?
No, no.
Okay. And how about your attention and concentration?
My attention is good, but doctor, I'm always worried that I'm going to get this problem.
So you're always worried. And how about your energy levels then?
I have energy, but the problem is okay, what am I going to do with this energy? I'm not able to go out of my life, out of my house.
Right, right. And are you sleeping well?
Yes, yes.
Are you eating okay?
Yeah, yeah.
Okay. You said that it has impacted your life a lot. Can you tell me more?
Well, doctor, not able to go to my work. I'm not able to take
Mm-hmm.
my children to school. I'm missing
Mm-hmm.
all the social activities. I'm always
Mm-hmm.
confined now to my house. I could hardly
Right.
now come to your clinic, doctor.
Okay. And how are you coping with this?
Well, I don't know what to do, doctor. I thought that today this nurse is going to help me with something, and he referred me to you.
Okay. Are you taking alcohol to cope
No,
sometimes?
no, no,
Or any street drugs?
no,
Okay. Have you been to psychiatrists in past?
no. This is the first time.
Right. Or did you have any major medical illness in past?
1 minute. No, no.
Okay. And how would you describe yourself as a person?
Well, as I said, I'm a type of person who gets easily worried, and I just like to make everything safe around.
Right. With all this going on, have you thought of harming yourself ever?
No, no,
Okay. Or going to repeated consultations or repeated investigations further?
no, no. I'm worried, doctor, to go out of my house. I don't want myself.
Right, Mr. Smith, it seems to me that you are having something called panic disorder, by which I mean that it is a condition where people have intense episodic anxiety, which is associated with feeling of dying very soon. But please don't worry, help is available in form of tablets, talking therapy through this multidisciplinary team at this hospital. Will that be fine with you, Doctor? Mr.
Yeah,
Smith?
yeah. Very good. Excellent. How do you feel about what you did? The
Um,
only thing which I want you to pay attention to is that when you take the complaint, so I said to you it started 6 months ago. So what happened around this time, and how was he doing before that? How, as I told you, doctor, nobody starts psychiatric disorder out of the blue. There must have been some sort of predisposing factors. When you put this in your mind, this means that you are eligible to be the member of the Royal College. Okay, this is how they think in the as examiners. So ask him. So before that, how are you doing? Okay.
Yes, thank you.
Okay. Well done, Dr. Sandra. So let's see our slides and if this performance can help you to score well in the mark sheet. Okay, so again, here there's a mark. Here you took the onset, you asked about the course and the duration. I hope that you'd have asked him how, was there anything around the onset and how was he doing before that? Okay. And then you took the symptoms of the syndrome. You asked about the comorbidity. Very good. You asked about the impact and the coping and risk. What I felt it was a bit disorganized because I felt that after asking about the past history and family history, you asked before the family history and past history about the impact and coping and risk, and then you ask about the impact and coping and risk again after the past history and family. So it was a bit just when you start one chunk, finish it. But I think this is not a very big mistake. Still, all in all, it was organized. And you delivered the diagnosis in a very good way, okay? Just try a simple explanation. So we all have a program which helps us to fight or flight. And in this, when this program is activated, our heart starts racing, we feel perplexed, we have rapid breathing, and our minds start to have some sort of apprehensive feeling. For unknown reason, this program starts without any reason in the panic disorder. That's why it is considered to be an anxiety disorder. I think this is what you are passing through. Well, I think this can be a simple explanation. Sometimes they can find it helpful, but your explanation is good. Okay, so let's see your mark sheet. Okay, so you identified the issues and your priorities here is the panic disorder, significant aspects of history, the complaint, the symptoms, syndrome, the comorbidity, the past history, etc. Everything in the aspects of history identified it. You asked enough about the symptomatology, and you asked about the risk, and you paid attention to what I'm saying, and you asked about the psychological and social information, so the history taking information as task, all you have scored them. Your communication was good. Very good, doctor. I don't have any other comment. Very well done. Thank you. Very clever, Dr. Sanders. Thank you so much. So who would like to go? I think it's the turn of Dr. Victoria.
Yes, I'd like.
Yeah. How are you, doctor? So what
Thank you.
station? What is your OCD? Okay. So now, doctor, this particular station, I think the Royal College, they want from you a particular thing, how to differentiate between delusions and obsessions. And to the extent that they write it in the task, I remember that they write it in the task, take history to elicit the obsessions. They expect from you to know how to assess the obsession. There is a simple acronym which will help you to remember what to ask in order to cover the assessment of depression. You are DROSI, D-R-O-S-I. D stands for distress. Okay, distress. Okay, we have distress. We have resistance. This is the R. O stands for own thoughts. S stands for sense. Does it make sense? Okay, senseless. And finally, intrusive. Okay, distress, resistance, own thought, senseless, intrusive, drowsy. Okay, so the obsessions must fulfill these, I think, five criteria. Five criteria to make sure that these are obsessions, not just overvalued ideas, just obsessions, not delusions. Okay.
Mhm.
And when you ask about the obsessions, make sure that you cover whether there are any other obsessions. Okay. So there could be other obsessions. Like what? What could be the
Like
other obsession?
images,
Yeah,
doubts.
exactly. Okay. So let's see. So we when I have the feedback, I will tell you what would be the other.
Mm.
Okay. So let's start. One, two, 1, 2, 3, go.
Hi, Mrs. Green.
Hello.
My name is Dr. Victoria, and I'm one of the doctors from the mental health unit. I understand that you've been referred from the GP to see us today.
Yes, doctor.
Could you tell
I
me
know
what's been
it
going
is very, very awkward, doctor. I know it is ridiculous, but I cannot stop it, doctor, because of this corona issue. I keep washing everything, and I'm not able to control this, doctor, and it's feel that it's totally corrupting my life.
It appears to me that you're going through a difficult time. But just to know more, what are these thoughts that you're having that's disturbing you?
I think that everything there is some sort of contamination, and I must wash everything around me and everything which my baby touches at least 5 times, and one of them must be with alcohol. I know that this is totally ridiculous, but I cannot resist it, doctor. So, and I keep doing this all of the day.
It appears to me that these thoughts seem to really distress you. Would you say these thoughts are yours?
Yes, they are my thoughts.
And do you try to resist them?
I try, but I cannot, doctor.
Okay. And you mentioned that they keep coming and coming. Would you describe them as recurrent and intrusive to you?
Yes, in the middle of anything I'm doing, I find that this thought comes immediately and totally dominates my life, my mind.
Sorry to hear that. And since when has this been ongoing?
Well, it started since the problem of Corona, or maybe 2 years ago.
2 years ago. Okay. Sorry to hear that. And since it started, have you ever done anything to help it? How would you say it has been progressing? Would you say
Well,
it's been getting
in the beginning, I was just washing everything, within the normal range. But with time, I feel that I must wash and wash again and again, and I must incorporate alcohol in the times, and they must not times of washing must not be less than 5. I cannot exactly tell you when it has turned from just normal hygiene to this
to
ridiculous lifestyle.
Sorry to hear this. And then I just wonder, aside from the needing to these thoughts that you have about contamination, do you also have thoughts about maybe self-doubt and
No,
needing to do something too?
no,
How about, do you have images also?
no.
And then you mentioned that you have to wash and sometimes wash with alcohol. When you carry out these rituals, how does it make you feel?
Well, temporarily I feel relieved, but again, I find that I must wash something else with the same sequence and same procedure. And all the day long, I'm in this vicious circle. I'm washing, and I don't know what to do actually.
Okay, so because sometimes sorry to hear that, sometimes when people have this sort of repetitive act, they also do things like checking and counting. Do you do
No,
that also?
no.
Okay. I just wonder, prior to all of this starting, did anything significant happen in your life? Is there anything ongoing?
Well, apart, no, I don't have any problems now.
Okay, okay. And I also noticed that you just gave birth of recent 6 weeks ago.
Yeah.
Yeah, how have things been?
Well, everything is okay. The problem is that now I feel that I must also include the baby in this in this ridiculous thing. That's why I went to the GP. I have this thought that my baby must also be decontaminated by this procedure, and I know that it can be harmful to him.
Yeah, it seems quite risky to the baby, I would assume. And
Yeah.
then it makes me wonder also, how was the pregnancy period? How was he planned pregnancy?
No, everything was good in the pregnancy. I didn't have any problem.
Okay, okay. And how is the support now at home? Do you have any support?
Yes, yes, my husband is very supportive.
Okay. And how has this impacted you?
Well, as I told you, I'm not able to do anything. I know I'm supposed to be a teacher. I'm not able to go to my school because I cannot apply this ridiculous life habit in the school, and I'm not able to go out because I cannot touch anything.
Sorry to hear that. Must be a difficult time. How about your relationship with your husband? How is it going with all of this happening?
Well, he started to be not happy with what's going on, though.
So sorry to hear. And this has been ongoing for a long time. Have you been coping with it?
I don't know what to do.
Because sometimes people cope using alcohol, street drugs. Have you been doing any of such?
No, no.
How has this impacted your mood?
I'm so frustrated, doctor.
Sorry. And then sometimes people
1 minute.
have you been getting enough sleep at all?
What?
Have you been getting enough sleep at all?
Yes, yes, yes.
Sometimes people have unusual experience, like hearing voices of people they can also see things not seen by others. Do you have this?
No, no.
Okay. You mentioned that sometimes you've needed to wash your baby things. I'm just wondering, any thoughts of harming your baby at this point? I know it's quite a difficult question to ask.
No, I don't want to harm him. I'm afraid that I might harm him because of this.
How about yourself? Any thoughts of harming yourself?
No, no, no.
Have you seen a psychiatrist in the past before?
No, this is the first time.
Okay, thank you for speaking to me. From all that you've said, it appears that you have what we call obsessive compulsive disorder, and I'm quite concerned about you at this moment. I feel that you will need to stay with us a bit.
Very good. Time. How do you feel about what you did? So it's good. It was good. How do you feel?
I just tried to cover.
Please give her your feedback, Doc. Now I wrote for you the acronym for the possible obsessions and the possible compulsions. The cigar and crow. Cigar, contamination, infection, guilt, aggression, religious, right and wrong. Crow, checking, counting, ritual, ordering, and washing. Just try to make sure that you're going to cover the symptomatology in depth. And this includes that you must ask about the obsessions and the compulsions in depth. Okay. But it was good for myself. It was very good. I love the approach, weaving question. Very good, very good. Sheena is cheering for you, and as well as everyone is happy with your performance. Okay, so let's see the mark sheet. Okay, so now, doctor, please, again, you see the mistake. I don't know why you are not, I don't know what is the problem. So I said that it started 2 years ago. How was everything before that? Did you ask me this question? How was everything I don't know if the candidates do not understand the importance of this period in the complaint. So it started 1 year ago. How this is our specialty. If definitely there's been something going on, and before that, you don't know, maybe one of her relatives died because of the corona. Just ask this question, please. The onset
Okay.
is important, and the period before the onset is very important. It's called the predisposing factors. Here are the predisposing factors, and if you went beyond this in the time, it's called precipitating factors. Okay, so pay attention to this. You ask her about the
Okay.
cause and the duration and everything else. Okay. The symptoms of syndrome, you covered the obsessions and compulsions in a very good way. You ask her about the comorbidity, the biopsychosocial. You ask her about the impact and coping and the risks, the past history and family history, and you deliver the diagnosis. Let's see your mark sheet. This is the mark sheet. You identified the issues and priorities. You paid attention to the significant aspects of history. You elicit what is much? Yeah. You listed you digged enough in the symptomatology, so the first 3 points are going to be scored for you. You assessed the risk. You paid attention to my health view, and it was a one-to-one conversation, and I think that's why this point is going to be scored for you. You asked me about the psychological and social information. Your communication was more than perfect. Very good. Very good, doctor. Have you ever been to the class before?
Yes, I have.
Well, I hope that you will pass this time. Okay, thank you so much.
Thank you.
Very clever.
Thank you.
Okay, who would like to go next?
I can go.
Yes, but where is? I think where is he? Where are you?
I'm here.
He is Razwan. I think someone.
Yes. Yeah.
Okay, Dr. Razwan. So what is your station though?
It's anorexia history taking.
Okay, give me 1 minute because there are many stations of anorexia.
It's station 105.
Yeah, yes.
Get through.
Okay. 1, 2, 3, go.
Hello, Amelia. My name is
Hello.
Dr. Rizwan. My name is Dr. Rizwan, and I'm one of the psychiatrists working here in this hospital. I understand that you've been referred by your GP regarding some difficulties around your weight. So can we have a chat around that?
Well, I don't know why am I talking to you. I don't want to be rude. I thought that he would refer me to the physician.
Yeah, as I want to tell you that, our brain and body is linked together. So sometimes because of psychological difficulties, we have some physical complaints. So that's why I'm talking to you. Is that okay?
Okay, no problem.
Yeah. Can you tell me more about what are you been going through?
Well, I was trying to diet and I wanted to lose weight, but I fainted in the gym. And they took me to the emergency room, and my mother took me the second day to the GP. And today he said that I must talk to a doctor.
Okay, it must be very difficult for you. Can I ask, uh, how long you been trying to lose your weight?
Well, I started to lose weight maybe 3 months ago.
Months ago. Okay, and what's your weight currently?
My weight now is 45.
45. Okay, and so you're saying that your weight, you start to doing exercises and trying to lose your weight for last few months. How was the thing before that?
Well, before that, I think I was not very happy because my boyfriend left me. And I think he left me because, definitely I'm not looking good enough. So I think this can, when I lose weight, I will look much better.
Okay, okay. I'm very sorry to hear that. Okay, can you tell me if you're using any other measures to lose weight?
What? What?
Can you tell me if you're using any other measures to lose weight apart from exercise?
No, I just don't eat enough. I just can have strict caloric, calculation in order to make sure that I'm not eating, more calories than what I need.
Okay, okay, okay. And have you tried any laxatives or any medications to lose weight?
No, no, no.
Okay, and have you ever tried self induced vomiting to lose weight?
Yeah, sometimes when I feel that I'm eating too much, I vomit.
Okay, and can I ask you, when you see yourself in the mirror, how do you see yourself?
Well, I feel that I can look better if I lost weight. I don't know exactly which part of my body which needs to must be thinner, but I feel that I must. It will be better if I lose weight.
Yeah, sorry, my internet was okay. And can I ask you about some personal questions? You're having difficulties with your periods. You're missing your period. Is that right?
Yes, yes, they are not regular for the past 2 months.
Okay, and okay, all right. And it seems like a very difficult time. How have you been coping with all this?
Although I feel much better when I go to the gym, and exercise, my mood, gets better, and this is my only way.
Okay,
When I feel
and
that I'm on my track on losing weight, this makes me feel better.
okay, and have you ever used alcohol or any street drugs to cope?
No, no, no,
Okay.
no.
And have you had any other complications due to your weight loss, like any other medical complications, like dizziness or stuff
Yeah,
like
yeah,
that?
I fainted in the gym, yes, and I fell,
Okay.
and I had some bruises. No.
Okay. Okay. And can I ask, have you ever seen a psychiatrist in the past?
No, this is the first time to see a psychiatrist.
Okay. And are you have any medical disorder or a medical complication?
I told you I don't have.
Okay. Okay. And Miss Amelia, can I ask you about your childhood? How was your childhood?
It was not a very happy childhood. My mother was very strict as well as my father. He was an officer. My mother was, he had teacher, and she was not very empathetic and was very dominating. I didn't feel that I was a happy child.
Okay, okay. And can I ask about your family? Has anyone in your family has a similar situation or a similar disease?
Yes, my mother was diagnosed with anorexia.
Okay, okay. All right. And how has you been feeling lately?
Well, I'm not happy because my boyfriend left me, but I feel that now I'm gaining control because my body now is much better, and I feel that I'm
Okay,
looking better when I lose weight.
okay. And are you
1 minute
uh,
remaining.
Okay, and how has your sleep and appetite been?
My sleep is good.
Okay, and can I ask if you have any thoughts of self-harm?
No, no.
No. Okay. Okay. So from our discussion, it seems like Amelia, you have a condition we called anorexia nervosa. It's because of uh, stressors and some genetic factors. A person can feel he's overweight and try to do the measures to lose weight. So we can have another session about that when I'll explain you the management options about that. Is that okay?
Okay.
All right. Thank you so much, Amelia.
How do you feel about what you did?
Uh, I think it wasn't organized.
It was
I think
very good until at the end you started to lecture about anorexia nervosa and you did not utter the word that it is an eating. Say if you at least say that it is an eating disorder. It is your homework to prepare an explanation. You have chosen this station. So if you want at the end of the station to explain the diagnosis, at least prepare an explanation which does not include jargon. You said that it has some genetic factors and you didn't say that it is an eating disorder. You said everything, but you didn't say that it was an eating disorder. So pay attention to this, please. This is the mistake which you should avoid. And when you ask about childhood, have there been any bullying before because of her weight? Because most probably these girls have been bullied because of their weight or have been exposed to a traumatic experience. Okay, so when you ask about,
नहीं
excuse me,
नहीं तुम पियो
so when you ask about the childhood, it's not just how they feel about your childhood. You want to ask specifically about weight bullying because this, changes the image in her mind since childhood that she is not looking good and she will always go in her life with this self-image, even if she does enough of loss of her weight. And when you ask about the menses, please, you take the permission and then wait to have the okay for this permission. So can I ask you a personal question? If she says yes, then ask about the menses. But I want to ask you a personal question. How is your menses? This is not the best way. You are supposed to be professional. So, okay.
okay.
Okay, lack of active listening, a bit checklisty. Sheena is very critical with you, so pay attention. But pay attention to your feedback. Well done. Bulimia symptoms need to be, yes. Bulimia symptoms, yes, must be asked. Okay, well done, well done. Well, no problem. There's no problem. Everyone can mess up here, no problem. But you did not mess up by the way. Okay, so let's see. The thing which I like that you asked about the onset, you asked about the course and the duration, and you asked about how was she doing before that? Because definitely the attacks of anorexia are precipitated by life events. Okay, so I like that you paid attention to this. Okay, so, and then you asked about the symptoms of the syndrome, but the only thing which you have missed, as our colleagues has pointed, that you should have asked about the bulimia. You asked about comorbidity. Did you ask about her social life? How did it affect her social life? You must ask, so how did this anorexia affect her social life? You asked about psychological and physical, but you missed the social. The impact and coping and risk, again, how it affect her life, you did not ask. You asked
I
about
asked
the
about
risk.
coping.
Not what?
Like I asked about how he's been coping with all this
Coping,
stress.
yes. How was she coping? But the impact on her life, because she is
impact
now
on her life.
adopting this anorexic lifestyle. So how did it affect her life? And she was dieting and exercising and past history and family history. Very good that you paid attention to this important point in history. But when you ask about the past history of the patient, ask her about her childhood, specifically about the either
Bullying.
that she bullying because of her weight or being continuously compared to someone else, and this will distort her self-image all of her life. And you picked up that she has positive family history of anorexia nervosa. Finally, deliver the diagnosis, but please pay attention. If you want to explain the diagnosis, you should be prepared with a better explanation. Okay, so let's see according to our slideshow. So you identified the issues and priorities. The aspects of the history, all of them were covered. You asked that enough details in this, though you missed the bulimia, but you asked enough details about the anorexia. You assessed the risk. You did pay attention to my health view. You assessed the psychological, but unfortunately you did not assess the social. Though, no, you asked her about, and did you ask her about her family now? So I think this point might not be scored for you, because it's very important in the case of anorexia to ask about the family. How do you describe this? Is and you can ask about this in the family history. So how do you describe your family? Do you feel that they are supportive and so? Not only about the family history of anorexia. So I think this point might not be scored for you. It was very organized, very, everything in your communication was good. Okay, this is just my personal impression about your performance, not a pass or fail, and also to help you to understand that it's all about this mark sheet. So whenever you are going to revise with your practice with your colleagues, make your reference this mark sheet. Thank you so much, Dr. Desmond. Very clever.
Thank you.
Who would like to go next? Okay, how are you, Doctor?
I would like to.
Yes.
I'm good. I'm good.
Dr. Sargan? Sargan?
Sargun. It's Sargun.
Yes, yes. Nice seeing you, Doctor. So if you can put your cam on, please, this would be. What is your station, Doctor?
It is 113 conversion disorder.
Yes, conversion disorder. So just have this is a very nice station. It usually comes. Let us see. Yes. Now, doctor, pay attention to the following. You know that this is a conversion disorder from the story, and there is nothing or not much to talk about on the progression of the symptoms, because it has just started and it is stationary. So what is the most, or where is the heaviest load in this station? It is in her social life, and if there are any stresses in her life. So this is what the station is all about, because we know that conversion disorder is a reaction to stressors. So we want to know exactly whether there are any stresses in any areas of her life, financial, emotional, familial. You don't know. You just want to ask her more about, dig more in her social life. Okay, very important, because those who did not do this did not pass, because it's all about the stressors. Pay attention to this, okay? We'll start now. So 1, 2, 3, go.
Hello, Anna. This is Dr. Sargun. I'm one of the psychiatrists from the mental health unit. Can we have a chat?
No problem, yes.
Yeah. So I was told by the medical specialist and neurologist that they have evaluated you for the leg pain, leg weakness you are having since morning, and they have got to know from your mother that there is some stressors involved. So can I have a discussion? How did this the weakness start? The left leg weakness start?
It was all in the funeral, doctor, and I was trying to carry the tomb of my father, but suddenly I'm not able. The left side, which was carrying it, suddenly I lost power in it. I was not able to move.
Yeah.
Coffin.
Um,
I'm
I-
trying
I'm,
to carry the coffin with them.
I'm extremely sorry to hear about that, and my condolences for your father's demise. Is it okay to continue?
No
Can we
problem.
have?
Yeah.
Yeah. Yeah. So you were carrying the coffin, and the weakness started.
Yes.
And right, right. Is it? Did it start or with some pain, pain or tingling sensation was associated with
No,
this?
no, just inability just to move the left side, all of it.
Yeah. Was any headache associated?
No,
There was
no,
any?
no.
Right, right. Have you ever had this type of symptoms before?
No, this is the first time.
Oh, oh, oh. I understand that you are going through a phase of stress. Uh, can you tell me, how did your father die, and what was the
Well,
circumstances?
it was a horrible accident, and I was the one who was driving. He was beside me, he kept telling me to slow down, but
Oh,
I didn't listen to him, and we had an accident, and he passed away. And all of them are blaming me because of this, and but I don't know, doctor, I don't know what to do.
I just can imagine that what you are going through. It must be quite distressing and quite troublesome for you, and quite traumatic. uh, Losing your father in an accident, and everybody is blaming you for that. When did this happen? Can you tell me more about it?
It's happened 1 week ago, doctor. The accident happened 1 week ago, and now
Accident.
he stayed in
Right.
the hospital 1 week, and he passed away yesterday.
Oh, 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 I understand. And uh, so you also feel that in a similar way, you are also feeling that it was your mistake. You feel guilty about that.
Yes. I'm to be blamed to a great extent.
Right, 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 right. I can understand. Uh, can you after since medical have you got any other stressors apart from this significant stressor, significant problem, like in your financial life or in your job life?
Well, job, yes. I think that they didn't understand my situation. I thought that I need some sort of vacation to take care of my father while he was in the hospital, but they were not very helpful. And they said that I just want to vacation.
I can totally understand. This may be also troublesome. In financial aspects, any problem you're facing?
Yeah. Actually, this job is not a good job, but I have some debts, and which I need to pay, and the only way to pay this is by accepting this job. It's far from my house,
Right.
not very good salary, but this is the only available thing.
I can understand what is going through you. Can you tell me, after this weakness started, how was your reaction? What did you feel? How do you feel about this weakness?
Well, I don't know, doctor. What can happen more than the death of my father? I don't care.
Right, right, right. And what does your family feel about this weakness?
Well, they have changed. They are now all supportive, doctor, and they are all caring for me since the
Right,
start of this problem.
right, right, right. I understand that after the accident, your mood has been low. Is it so? Your mood has been low.
It has been low, and it's more low now because of the death of my father.
Right, right, right. Are you able to enjoy the things which you previously able to enjoy?
Definitely no, but
Right, right. I can understand that. Uh, how's your sleep like? Uh,
well, it's not good. Definitely, I always sleep crying because of my father. But
Right, right, right. And how's your appetite like? Are you eating well?
Yes, yes, yes. 1 minute remaining.
Yeah. Some people when they have these, they also have some unusual experiences, like hearing certain voices. Have you had such an experience?
No, no,
Right, right. Are there any thoughts about harming yourself? And
no,
right,
no,
right, right.
no,
Has there been any family history of any psychiatric illness?
no, no, no,
Okay. Has there been any visit to the psychiatrist in the past?
no, no.
How have been you coping with this whole throughout? How have you been coping with it?
I don't know what to do, doctor. I don't know what to do. It's very, very tremendous stress, which I don't know what to do.
I can imagine. Are you using alcohol or any drugs to cope up with this
No,
problem?
no, no.
Right, right, right. So as I understand that you are had a significant amount of stress, and my appreciation is that you are having uh,
Time,
is it
time, time. But
okay, sorry.
you just next time pay attention to the time. Okay, you could have managed a very good job, by the way. Very good job. Just pay attention if there is any familiar stresses other than the criticizing because she might have problems with her husband. That's it. The only thing which you've missed. But everything. And you must say that she has conversion disorder. And if you have a simple explanation, say it. But don't go through lecturing. So if you have a simple explanation at the end of the station, do it. For example, you have been through a tremendous stress, and sometimes when the mind cannot tolerate this stress, it converts it into physical symptoms. That's why it is called conversion disorder. I would like to have another meeting with you to know how we can help you. That's it. Okay. Let's have the feedback of our colleagues. Good job. Moran is giving you a very good feedback. So let's see our marks. Okay, so this is so very good that you paid attention to the complaint, how to take it, how did it all start, what happened before that, you paid attention to, and the course and the duration of the symptoms are not typically stationary and they are not associated with anything. This is not a typical physical complaint, okay? Usually there is some associated other physical symptoms and it is either progressive or regressive. The no physical complaints are stationary from the beginning like this, except when they become chronic, there is something else. So you paid attention to the symptoms of syndrome, very good. And then you checked for the comorbidity, particularly social stressors associated with this, and how did these stressors change when she had these symptoms? And label indifference. Okay, so and I was happy that you asked me, how do you feel about this? It is very common that those who have conversion disorder, they are not that much distressed by their symptoms. Okay, so I have demonstrated that I have labeled indifference, and you asked me about the social comorbidity, and you asked me about psychological comorbidity. Physically, she has been physically cleared. The impact and coping and the risk, you asked about them, the past history and family history. Did you ask me if I have been in contact with psychiatric services before?
Yeah, I asked.
Very good. And then you delivered the diagnosis. Unfortunately, you do not have time to deliver the diagnosis. This will be left to the examiner to assess what is the burden of this mistake. So we don't want to put ourselves in this situation. Always in history taking, you should deliver a diagnosis at the end of the station, because after taking all this information, definitely you should come up with a diagnosis. Okay, so let us see the mark sheet. You identified the issues and the priorities, very good. You recognized the significant aspects of the history, very good. You explored enough details the symptomatology, the symptoms of her weakness and the stressors. You checked the risk and you paid attention to my opinion. It was very good. You asked me how do you feel and what is your explanation. Very good. So see, this simple question helped you to score point number 5 and does not identify appropriate psychological and social information, and definitely the associated psychological information are very important in this type of stations. It was very organized, though it was organized, but this point might not be scored for you, point number 7, because your time management was not good. So this point might not be scored for you. So this point is about organization and management of the consultation, and the management includes the time. So this point might not be scored for you. Consultation was not formatic. Everything in your communication was good, except that you pay attention to the time. Thank you. Very clever, Doc. Have you ever been to the CASC before?
No, I have not been to the CASC.
Well, very clever. This is the first time for you to very clear. Okay. Thank you so much,
Thank
Dr. Salgo. You are very clever. Who would like to go next?
Can I go next?
Yes. Who? Oh, sorry.
Dr. Iman.
Dr. Iman. So what is your station, Doctor?
Station number 8. Anxiety disorder, social phobia.
Yeah, the social phobia. Yeah, this is very good. Okay. Pay attention, doctor, to what happened before the onset. So the precipitating and the predisposing factors. Okay, very important. Okay. 1, 2, 3, go.
Hello, Mr. Lewis.
Hello, doctor.
I'm Dr. Iman, one of the doctors in the mental health unit.
Hello.
Yeah, your GP has sent you to talk to me. I understand that you're waiting for your wedding.
Yeah, doctor, it is very bad thing, you know. So
congratulations.
I'm about to have my wedding maybe 10 days, the coming 10 days, and now I'm very anxious because I'm not accustomed to be in this situation, being the center of attention to everyone. And this, just thinking of this makes me tense, and I don't know what to do. I'm thinking just to cancel the wedding or just to talk with my girl to see if there's any other plans which we can do. And she said that I can talk with the psychiatrist because I think that, and she has right. It's too much actually what I feel about the situation.
So I understand that you're feeling anxious about the wedding day.
Yeah.
Did this happen the first time? Like being anxious?
No. This is my usual, doctor. I don't like to be the center of attention.
Okay.
Many people. I just avoid these gatherings, and if I'm in a gathering, I just try to be in the periphery, not in the center of any attention.
Can you remember the first time that you felt that way?
Yeah. It was it was in the high school. It was a ceremony at the end of the school year, and I was going to take my certificate from the headmaster, and I stumbled, and everyone laughed at me. And this situation, it's stuck in my mind that whenever I'm in a social gathering, this can happen. So.
Yeah, must be
I think
difficult.
then I avoid any gathering. Yeah.
So you felt anxious, and after that, you're trying to avoid any similar situations. And how did this progress? Was it getting worse with time?
Well, just trying to avoid any gathering, any situation which I am in center of any attention. I dropped many jobs. I always avoid social gatherings which more than 3 or 4 people, and if I'm with anyone, I must be people whom I know and those people.
Can you tell me about what's going through your mind being at that situation at that time? What was running?
Well, I always think that I will do something silly which will make me look ridiculous in front of the people, and the people will make fun of me, and I will, will not be able to talk, and I start
Okay.
to sweat and tremble. And the only solution for me is just to flee, just to avoid this situation.
So you feel changes in your body. You mentioned sweating. Have you ever felt like you're going to choke or?
No. Just I feel uncomfortable, to the extent that I'm going to not able to do the thing which I'm going to do. And if I talk, I feel that I'm hesitant. I'm not good in talking in front of the people.
Yeah. Do you feel palpitations?
Yeah.
Yeah.
Sometimes, but not always. Sometimes, but not always.
Okay. Do you have any other fears rather than being in social interactions? For example, some people fear certain animals.
What?
Do you have other fears, excessive fears from any other situations?
No.
Yeah. From heights, for example.
No.
Or going outside your home.
No.
Or you worry a lot about everyday things.
No.
Okay. Have you ever have episodes of sudden fear, excessive fear, as if you're going to die or something?
No.
Okay. How did this impacted your life? I think this is very difficult time for you. How did it
the
impact
problem?
your social life?
It affected my life. I'm about to have my wedding now, but I'm very late. It started my life as family life, and I'm avoiding a lot of the social activities. I dropped very, very good job opportunities, but including them facing the people and being the center of attention.
So this
I
is
prefer
impacted your
always
focus.
to have solitary activity. I'm a computer technician, and I think this is the best job for me because of my personality.
Yeah, I'm sorry to hear about that. And what about your mood? Did this impacted your mood?
No, my mood is good. I don't have any problem with my mood.
Yeah, you still enjoy things that you used to enjoy before.
Yes.
Yeah,
As long as there is no center of attention.
Yeah, sometimes people they try to cope with stressful situations by using things to ease their anxieties. Have you ever tried to use something like alcohol, for example?
No.
Okay, and what about using illicit drugs?
No.
This is the first time for you to be seen by a psychiatrist.
Yes, this is the first time to see a psychiatrist. Yes.
Yeah, have you been suffering from any medical problem you're following with the doctor for?
No.
And what about your family? Anyone in the family suffering from any psychiatry illness?
1 minute. No.
Okay. What about your childhood? Do you remember anything specific in your childhood?
No, nothing specific apart from the incidents in the high school. That's it.
Yeah, difficulties while starting the school, for example.
No.
Okay. And if I ask you to describe yourself as a person, what about your personality before having this problem?
Well, I was, I was still young. I can't say much about my personality. But
Okay.
it was in this high school.
Oh, thank you so much for sharing these information with me. And I can see from the information I gathered that you're having a social phobia, which is anxiety disorder. This is an anxiety that arises whenever you have any social interaction and you feel changes in your body, and this will make you feel that you're getting embarrassed, and this will lead you to avoid being in similar situations. I'll give you leaflets about it. And
time. Very good, very, very good. Have you ever been to the cask before?
This will be my second attempt.
Very clever. I didn't write any feedback actually. Very, very, very clever. MashaAllah, MashaAllah.
Thank you.
Even in either of the candidates, no one wrote anything except that well done. Well, everyone is praising you. Great job. Very good. So let's see, according to our slides, just to make us our assessment objective as much as possible. Subjectively, I feel that you did very well, but again, this is not the reference. So you ask about the onset and you ask about how was everything before the onset and the course after that. Very good. You complain in a very good way. And you ask about the symptoms of syndrome, exactly what happens in this behavior, in these episodes. So whenever you want to assess any psychological phenomenon, try to assess it by asking about the domains of thinking and feelings and behavior, and if there are any physical symptoms. Okay, so whenever you have, for example, this social phobia, so whenever you are in between people, what exactly do you think of and how do you feel? So eventually, what is your behavior whenever you have these feelings and do you have any physical symptoms? These are the four domains by which you can assess, analyze any psychological problem, any panic disorder, social phobia, anything, thinking, feeling, behavior, and physical symptoms. And I think you covered most of them. Okay, so again, the comorbidity. You ask about the comorbidity, social and biological. You ask about the impact on his life and coping and risk, past history, family history, and eventually deliver the diagnosis in a very good way. Let us see your mark sheet. So I identified the issues and the priority. Your priority here is to assess the social phobia. Very good. And the aspects of history, you covered them, and you digged enough in the symptomatology of the problem. Did you ask about the risk? Any thoughts of harming you?
I think I forgot about the risk. Yeah,
So
I
this
wrote it there in
one,
my notes. I forgot it.
so though I felt that you did very good, but if I am the examiner, unfortunately, this point might not be scored for you.
Mhm.
So pay attention to the risk. Always show that you are a practitioner who puts the safety of the patient in his mind, even in a social phobia, in hypochondriasis, in any station. Okay, you must ask about the risk because simply there is a point about the risk in the mark sheet. You paid attention to my health view. You asked me about the psychological and social information. As for the communication, more than perfect. Well done, doctor. Well done. Yeah, scoring the 12 points is just very far. Maybe very good to score 11 or 10. Very good.
Thank you so much.
Thank you so much. Thank you so much. Okay. Who would like to go next? Have we finished?
No, I think I'm left.
Okay.
Mine
So
is the last station.
what is your station, doctor?
It's station 29, post-traumatic stress disorder.
Yeah. Okay. Ready?
Right. Okay.
1, 2, 3, go.
Hello, Mr. Jones. I'm Dr.
Hello.
Laspal. I'm one of the psychiatrists in this mental health unit. So
Hello.
I understand that your GP has some concerns for you.
Yeah, doctor. Yeah, yesterday I punched one of the waitress, and they suddenly started very loud music, and I jumped and punched him in his face. And I don't know what happened actually. Despite the only thing which helped me that they know me. Otherwise, I could have been in a problem with the police. So I went to the GP and discussed this with him. He said that I must talk with you.
Right, Mr. Jones, it does sound serious what happened yesterday. So can you tell me, has something similar happened before?
Yeah, it happened. It started to happen after, since I've been in Iraq. This was about 6 months ago or 8 months ago. Whenever I hear something loud or something happens suddenly, I just attack anyone around me and I'm always on the edge.
Right. So like you're telling me, this has been occurring since the last 6 months.
Yeah.
So did anything happen at Iraq, Mr. Jones? Did you undergo any stressful?
It was a very, very unfortunate incident in which suddenly all my colleagues, in one second, all of them died. There was a mine, and I was just a bit far from them, and this mine exploded. I don't want to talk about what.
I'm really sorry. I'm really sorry to hear about your colleagues, Mr. Jones. I can understand that you're very distressed. If you're okay, can we continue our assessment further?
Okay.
So, Mr. Jones, like you told me that you saw your colleagues in a second, they died matlab, in front of your eyes.
No, yeah. This was a horrible accident. Something which I don't want to remember.
Right. So, can you tell me how's this incident affected you?
Since then, doctor, I became on the edge always, and it happened maybe in the army 4 or 5 times. I suddenly just start to attack the people around me, and then eventually they said that I'm not fit to work anymore as a soldier in Iraq, and they sent me back.
Sorry to hear that things have not been going well at your work. So, Mr. Jones, do you also find yourself getting more annoyed or irritated more easily nowadays?
Yes.
Do you find yourself experiencing any difficulty concentrating at work or having any memory problems?
No, I'm not able to focus on anything. No.
Right. And Mr. Jones, have there been times when you feel that you're reliving the incident, you're having repetitive or maybe vivid images or recollections of what happened?
Yes.
And do you also, how has your sleep been lately?
I'm not able to sleep well. Any simple noise can wake me up.
And do you also sometimes wake up due to any nightmares?
Yes. The nightmares about what happened.
About what happened? Right. So, Mr. Jones, since you've been sent back home, have you been avoiding any news or any events related to what has
I
happened?
avoid anything related to army and artillery, anything related to Iraq, anything related to policy.
Right, I can understand. Can you also tell me what are your thoughts about returning to work? Are you planning to resume work?
No. I've been terminated, and I'm happy with what happened. I'm not able to go back to work.
And how will this affect your work?
What?
How would this affect your work?
I'm not able. I've been terminated. I said I've been terminated from my work.
Right. So, Mr. Jones, can you tell me, are you experiencing any difficulty experiencing any normal emotions lately?
Well, sometimes, doctor, I feel that I'm not able to control my emotions, and sometimes I feel that I'm not feeling anything. Just something which I feel that it's not good.
Do you find it difficult, Mr. Jones, to explain to people what you're feeling?
Yes.
And do you ever feel like you're not, that people around you or yourself are not real?
Yes, sometimes feel that everything around me is a movie. Yes.
Right. Mr. Jones, in light of all this that has happened with you, how has your mood been lately?
Well, I don't feel anything. Sometimes I feel angry. Sometimes I feel frustrated. Sometimes I feel that I don't feel anything.
Do you find yourself
1 minute.
do you find yourself having interest in things you previously enjoyed?
I like to go to do the things which I want, but I can't. I wanted to go to the pub as I used, but I punched one of the waiters.
Mr. Jones, do you find yourself sometimes worrying excessively about everyday activities?
No.
Do you ever have episodes of intense anxiety where you might feel like you might die or lose control?
No.
And so, Mr. Jones, what it appears that you've undergone through a very difficult time. Have you ever had thoughts
of harming yourself?
No, no,
And have you been using any alcohol or any other drugs to cope with your current situation?
no.
Mr. Jones, have you ever seen a psychiatrist before?
No, this is the first time.
Is there any family history of psychiatric illness in your Is there any history of psychiatric illness in your family?
No. Time.
Uh,
How do you feel about what you did?
I missed a lot of
Look,
important
doctors,
things.
just let us have an agreement in order to have better time management, and think of it whenever you are in a station with a history task. Whenever you hear the bell of 6 minutes, immediately start the impact coping and risk 0.5, 0.6, and 0.7. You can hardly finish these 3 points in the last minute. If you haven't reached the point number 5 yet. So immediately when you hear the bell of the 6 minutes, leave whatever you are doing and start point number 5, 6, and 7. This will help you to have better time management. Because if you base the impact coping and risk and families and past history, or the delivering the diagnosis, definitely this will have more negative impact than not completing the comorbidity. Okay, very important, doctor, to pay attention to your time management. Number 2, doctor, don't do the mistake. You are supposed to go there and saying, I'm a member of the Royal College. And we all know that in post-traumatic stress disorder, we don't do debriefing. There is no benefit for you to know what exactly happened in the incident. All what you know, so have you felt that your life is in danger? That's it. You don't need to know the details, what exact, and I showed to you that I'm not happy, but you still ask me. This is not good. If some examiners will feel that you are not good in this station, in particular for this point, if you have a post-traumatic stress disorder, it's not your job to do debriefing. Never do debriefing. All what you want to know, if it was a life-threatening situation, that's it. The details are not important. Okay. Number 3, you would be checklist, a bit checklist at the end, and did not deliver the diagnosis. Let's see the feedback of our colleagues. Was more checklisty and showed empathy. She showed empathy to some extent. And pay attention to the acronym, which will help you to cover the main domains of the post-traumatic stress disorder. I did put it in the chat section here. H stands for hypervigilance. E stands for emotional numbness. And emotional numbness and loss of control of emotion. And under the emotional numbness comes the derealization. Okay. A stands for avoidance, and R stands for recall. So these are the 4 domains of the post-traumatic stress disorder. Let us see according to our mark sheet, to our slide. So this is our complaint. How did it all start? Unfortunately, you ask about what happened before the onset in a very good, but it was good that you wanted to know what happened before the onset, but unfortunately, this is not the type of a problem which you should dig more in the details. It is not accurate. Okay, and then you ask about the course and the duration, very good. So you took the complaint, let's say 75% in a good way. The only mistake that you insisted to know the details of this unfortunate incident, though I showed you that I was not comfortable.
Yes.
Then you took the symptoms of syndrome accurately, and you asked about the psychological and social. Did you ask about the social impact on his life?
No.
Pay attention, doctor. Social impact is very important because this man, his social life is devastated. He left his job. and definitely it affected his income and all the social consequences which can happen after that. Definitely affects his social life. Physical, I think you asked about the physical, did you? Did you, doctor?
Physical.
Okay. Again, impact ICR can help you to remember that the impact of this problem on his life. But you covered the risk. You were in the past history and family history, and unfortunately, you did not continue to deliver the diagnosis. Again, doctors, whenever you hear the bell of 6 minutes, immediately start point number 5 to ask about. You can hardly cover point 5, 6, and 7. Let's see the mark sheet. You identified the issues and the priorities. You recognize the significance of aspects of the history. You elicit enough details of the symptoms. You ask about the risk. I think, I don't know, maybe this point might be scored for you. What is your explanation to what's going on? I hope that you could have asked me, so what is your explanation to your difficulties? And you identified the psychological, but the social information you did not identify, so this point might not be scored for you. Again, because of the poor time management, 0.7 might not be scored for you. Otherwise, everything is good, except your questioning style. It is on the borderline. It can be checklisty or it can not. Again, depending upon the exam. Okay, very clever, Dr. Mike. Have you ever been to the CASC before?
No.
No, for the first time, this is very good. More than good. Thank you so much. Very good. Who would like to go next? Are we finished?
Can I do a station if no one else is doing?
If there is any station left?
Like, could we switch to apart from history stations?
No. Today we have a list which we do only this list. We do only 8 stations. It is not an open industry. Come on.
Okay, that's okay.
Next time. Okay.
Sorry.
Okay, so I think we have finished. I really feel that it was a privilege for me to be with you. Again, doctors, this is only 50% of your preparation. The backbone of your preparation is to be with your study partners on regular basis and to have your plan in preparing for the CASC, which is not far, by the way. We have started in December. We are now in December. So I wish to see all your names in the pass list. Thank you so much. Have a good night.